Great. All right, it's 6:30. Got about 10 people on, so we're going to get rolling. A couple people will pop in. So I just want to say hello to everybody and hope things are going well for you guys. Summer's moving right along. I can't believe that it's already middle of July, and you guys are really getting close to being done. So for those of you who had reservations about taking a course in the summer, reduced in time, more intense content, 2 more weeks and you're done, and you've got 2 more courses, so you can scratch off of your list. So that's good news. I want a couple reminders. What I want to do tonight is really 3 things. I want to go through a couple housekeeping activities. I want to review the survey results that you folks, a number of you responded to, and talk a little bit about the course structure, sort of from a technical perspective, because I want to give you guys an update on where we're heading.
Move back, because I'm trying to finish my paper and I'm getting distracted.
What's that one? Oh, sorry. So
No,
hi, Wendy.
just by everybody, everything I'm getting distracted by.
Hey, so you know, I want to talk a little bit about the fall, and when we're starting up August 24th is the first week of classes, and kind of go through those survey results on the structure of the course and get your guys' input on that, because it's really important as we build more courses. And then the other thing I wanted to do tonight is to give a few folks who wanted the opportunity to gain some extra credit the opportunity to share with us something that they've been reading about in the literature, topic that's the current topic for the day. And we've got 5 people who have signed up to do that. And so Shalini, Jennifer, Kennedy, Jill, and Whitney have all offered to share with us their articles. And so we'll look forward to hearing what they have to say. So are you guys getting background noise? Is it me or is it someone else? Anybody know? I'm hearing, I hate, if you guys are hearing okay, maybe it's just me.
There's background noise.
Yeah, I think there's some backgrounds. I think there's a way for me to mute everyone. And I still haven't gotten that. Does anybody know off the top of their head how to mute everybody on the call? Somebody have the secret to do that? I know there's a way to do it. There's a mute all button. I don't see it, but anywho, so let's just get rolling. So the couple of housekeeping things I wanted to go through is, again, just reminding folks that we're getting very close to being done. When you guys submit your written assignments, we have 2 more that are in the hopper. I really want to encourage you, please save the file in a PDF format. Save it in the way it's outlined in the assignment, and then also please submit it all the way to final, because if it doesn't go through final, then I don't get it, and I've got to go get it. It has never made it through unit check. And so most of you guys have figured out that process. If you don't get it, send me an email and I'll walk you through it. But it's really important to get those submissions in the right format. The other thing is that, you know, I love giving everybody as many points as I can, and I'm still having to reduce points for if the written assignment question has 2 parts of the question, make sure you're answering both questions, because if you're only answering one of the 2 parts, then under the requirements section on the rubric, you're already not meeting the requirements for the assignment. And so that's a ding there, and I hate when that happens. And then the other piece is that please make sure you are you know, formatting the paper, double space, the reference page is its own page, and all those references are outlined correctly, because the APA is important. And I just got a Christmas gift. I actually just received the brand new APA manual in the mail. I ordered that, so I have the brand new one. This is the 7th edition, and I'm not telling you to run out and get one. But the other thing that I got too, which is I really like, is that they have this card thing, which is kind of like a APA guideline sheet. Amazon, baby. So you know, you're going to be in APA the rest of the program. It's worth the investment of either the book or the card. And so I just wanted to get a current version. I've been using APA for years, so I wanted to have a current document. So we'll continue to focus on that. Next thing I want to talk about was the fall, and we start courses 8/24. So you'll have from August 1st until August 24th off, so I know it's a much needed break for everyone. I'm sure you're looking forward to that. In the fall, at least for the law course that those of you who are enrolling in, Dr. Kate Starnes and I will be teaching that together. So Kate Starnes is a great person. Really enjoy working with her. She's an attorney. She works at the Health Science Center. She runs all the practice management area for all of the contracting for the health system. And so big job, big knowledge base, a lot of good experience. And so we're gonna partner together to work on that course. We're building it right now, and somehow we're trying to figure out how that'll all work, especially with, it looks like it's going to be another online semester for us. It won't be any face-to-face as we know right now still, because the jury's still out on that. But I think Blue Cross Facilities has been pretty clear that they're not wanting big groups of people back in at least the Richardson building. So given with until COVID gets worked out, then for sure in Richardson we'll not be meeting there. And so as Kate and I have been talking, I wanted to get your folks' feedback from the online experience, and so I put the survey out in Moodle, and I wanted to go through. It's hard to hear me, Kara. You guys hearing me okay? Aaron, I can see Aaron and Jennifer. You guys hearing me okay? Everybody else is on, not a video, so okay, good. If you guys can't hear, if you get any problems with me, just holler. Anyways, I wanted to go through the survey results because I don't know if you folks are able to see them or not. And I want to just open up the mics just so that there's a couple things I really want to make sure that, given this online experience is new for a lot of people, some people are comfortable in it. Are you guys getting what you need from the experience? And so the format that I selected, I want to get some ideas on that, and then I want to talk a little bit about some of the other items. So I'm going to share my screen right now, and I'm going to show you guys the survey results that we, and let's see if I can go find those for us. Let me know if somebody can go off mute and just tell me if you can see the screen.
We can.
Good, great.
Yes.
So first of all, I want to thank everybody for doing the survey. Really, I have 15 responses out of our class size is really good. But what I did is I tried to get feedback on all of the modules. I'm not going to spend a lot of time on this, but I want to just whip through it. So in terms of the overall format, it seems like most folks liked having the very condensed read, scan, do format. So unless somebody says, that's absolutely not working and has reasons how they'd like to see it differently, we're probably going to continue with that into the next semester. The information of all section, that's where I put updates for everyone and those get sent out to you folks and in the announcements on when grades are posted, etc. Not planning on making any changes unless you folks feel there needs to be. There's a large number of folks, about out of 15, 12 that are 13 either agreed or strongly agreed that was a good approach. And then the learning objectives, that's where we wrote out the objectives and then had an intro in writing. The piece that I wanted to pause on though, and that was the video overview. And I wanted to get feedback on whether you felt, the data looks like folks feel that it was helpful. There a large percent of people said either agree or strongly agree that those video modules are about 20 minutes, that people felt that those were helpful. There were about 5 people who really weren't sure, or a couple that thought they didn't like them at all. And so I'd like to just pause for a second and see if there's anybody who had any feedback on how to make those better, those videos, or to enhance them, or if there's another way to get that content out to the class. I'm not a big fan. I don't think people want to sit in front of a video online and watch me talk for 2 hours. So I'm going to pause there and see if folks have any thoughts on the videos. Outside, if you guys think they're fine, then let's not waste a lot of time.
It's Melissa. I'll comment. I really like them. I was a strongly agree. And the reason I like them is that they help guide what I'm actually reading in the chapters.
Okay.
Because what you're focused on, so then I can focus a little bit more my attention to the certain areas.
Okay. Thanks, Melissa. That's good to know. What were your thoughts on that very short video at the end called "What's Next"? Was that a waste of time? Or was that helpful? That's about a 5-minute or less video on sort of.
I like the shorter better.
Mm-hmm. I mean, well, I was really wondering. So you even have the initial video be shorter than 20 minutes, sort of the initial overview. Because what I was trying to do is I was trying to put bookends around the course, all the content. I was trying to say, hey guys, this is the stuff that's really important. Spending a little bit more time. I think 20 minutes is probably too long. Probably need to cut that down to about 10. And then I was trying to, at the end of after you went through all that stuff, I was trying to close out with another video. And that's what I'll shorten the front end video. What about the back end? Is that back end video helpful as a summary or not necessary?
Dr. Marion, can I please share my input?
Please.
I like your long videos. I would not request you to cut them because I take notes from it and it helps me. The only suggestion I do have, you have that PowerPoint presentation, which helps a lot. So I would only suggest that if you present it while you're talking, so I know where you are, because I start my week with your presentation.
Okay.
And then I look at the PowerPoint. But if you could show that PowerPoint and talk.
Got it. Okay.
That's just my thought. Please don't lessen it because my thoughts come from there and I listen and I take notes and they are critically important. And I'm sorry to say, I don't listen to your wrap-up message because I'm too tired by then.
Yeah, no, that's fine. Hey, look you guys are busy. That's why I want to make sure that if I'm doing something, it's helpful, and if it's not, let's kill it. So, that's great, Shalini. I'll both of you, Melissa, thanks for that feedback. Well, what I'll do is I'll actually go through the slides as we're doing the talk, the update or overview on the content. So great. Anybody else? Any thoughts on the videos? Okay.
I enjoy the 20-minute videos, and also agree maybe go over this, present the slides as you discuss them. That way we can follow along through the PowerPoint as well.
Yeah, I like that, Enrique. Yeah, Enrique, I think that's a really great idea. Great. So again, I'm just moving through I'll move through the results. Again, overall, the survey results were that people felt that the information presented was helpful. And then a little bit thinner on the web resources. And then there's the What's Next video. You can see where people with how their feelings were on that. And then we got into some feedback. And I'm not sure if the students, if you folks are able to access all this, but I think you can right in the module. And the nice thing about that is that I have no idea of who submitted the feedback. I love the narrative feedback. I think it's really helpful. And one point I wanted to just mention is that one of us was saying that they're spending a lot of time on the written assignments, about 8 hours plus. And so I don't know who that is. I actually am not going to dig into it. I don't think I can. I wouldn't even know where to start. But reach out to me with an email if you're spending that much time, because I want to help you maybe look at the assignment structure, how you're approaching the work, because I do not want anybody spending that much time writing those written assignments. The material, the content of the information that you need is pretty. I was hoping that it was clearly spelled out for you in the materials, so you wouldn't have to do a lot of digging. And you could supplement that with some other readings, other resources. And so please reach out to me and let me know how I can help you so we can get that time much more manageable for you. Because I don't want you spending 8 hours writing a 1,000-word assignment. So I'm going to pause there and see if there's any other comments about the structure of the course. If anyone has feedback on how to make the course better. Okay. Very good. Well, what I want to do now is that we're going to turn the channels, and we're going to try something that I haven't done before on a Zoom call, and it'll be interesting to see how it will go. And this was sort of a test balloon, and so I added the extra credit assignment. I wanted to see how does a joint sharing go on a call with folks. In a classroom, it's a great opportunity for people to bring an article to the class, and you can discuss it as a group. That's really the whole point of discussion boards and online courses. I don't think they always work as well as they could in compared to face-to-face, but that's here nor there. But 5 of you brave folks offered to share with us a current topic that you've been reading, and I thought we'd hear from you on what your summary of that article was, maybe how it relates to the topic this week, you know, population health, the medical model, the health model, to where we're now with population, social determinants, all of that is so important, and especially with COVID. You know, we're hearing so much about social determinants, about the population and their health and groups of people and et cetera. So I think we'll be right on track. So Shalini, Jennifer, Kennedy, Jill, and Whitney are the folks in that order, and we're going to stop at 7:30, and so we'll see how far we get with the discussion. So I'm going to turn the mic over to Shalini, and Shalini, if you need to share, you have access to the share screen, but I'm not sure what your plan was. So we're going to left it totally up to you guys.
I'll just talk about it if that's all right. And I have made my notes and everything. I didn't start the video. I don't know if you all want to look at me, but let's talk about this. So thank you, Dr. Marion, for introducing us to the very important topic of population health disparities, and the topic that I am picking up here especially. It's basically from the PMC publication number 2690341. This was done by Meader, Depp, and others. So the topic is message design strategies to raise public awareness of social determinants of health, which is your SDOH, and population health disparity. So we are all, I think somebody's phone is making a waterfall noise. Not sure. Okay. So this research is really very important in the sense we all continuously talk about population health disparities based on social determinants of health. But what we don't generally talk about is message design strategies that would bring awareness of social disparities to light, and not just for the public and the population at large or the targeted population, but also to the people who are designing the Oh, sorry, I was muted.
Shalini, that was me. Kander sent me instructions on how to mute everyone, and because you said somebody was having the background noise, and I muted you. Sorry.
No worries.
Then I was trying to like unmute you, and I couldn't figure it out. So.
Sorry. Should I start again?
Chander, thank you for those. It does work.
Should I start again, Dr.
I think you should keep going. You're doing a great job.
Okay. So the article has 2 goals. So we'll go fast, and I'll just present it to you for a few minutes to catch your attention. The aim is we are going to talk about message design strategies that would raise public awareness of social determinants of health and population health disparities. So the aim is message design. And there are 2 goals to this document. And if you all would like, I can send you all the link to this document. Wonderful read. The 2 goals are basically to give population health scholars and advocates a framework for thinking about and creating more effective messaging, because these messages are not reaching the public. They are not reaching the people who are actually designing in the government what should be done for those populations. And the second goal is to develop an agenda for future research in this area. So not much research has been done in this area, which is the message design strategies. So little research has been done, and this is basically inducing people to research more of what are the ways to reach people. Believe me, most of us don't want to read pamphlets. A pamphlet is given to us, we put it for recycling probably, or read it just a few sentences and throw it away. So here we are. So
Shalini, let's just, let me just throw some at the group.
Sure.
And this is an excellent article, by the way, and I think that the topic is so important. And basically, it's about getting messages out to people, right? I mean, is that the bottom line, Shalini?
Absolutely.
Yeah. So I think we need to really think about this, because this is not only a marketing discussion, this is a public health discussion too. And,
Yeah.
and I think that's important for all of us as healthcare leaders to understand messaging does not work to the population as well as it should. Look at the whole issue around mask wearing, or look at the whole issue around social distancing, or anything that we're told to do. Wear seatbelts, stop smoking. I'd like to hear thoughts from folks on what are the challenges within, and this applies very much so to the marketing, because remember, one of the benefits of the purpose of marketing in a healthcare organization is to communicate, not just sell, but to communicate, right? Healthcare information. Any thoughts on that? And are people dialed into that reality that it's really hard to communicate about health-related topics?
Absolutely agree, Dr. Marian. I'll wait for feedback from others, and then actually that's a part of the research, and then I will share input from the research itself about the challenges.
Mm-hmm.
Thank you, Dr. Marian.
Mm-hmm.
Dr. Marian, I'm sorry, it took me a minute to unmute. This is Jennifer. I was just going to say, one of the things you have to have going is that your population, they have to be engaged in whatever this cause is that you want to do. And it's hard to get a population group or whatever engaged in anything. They've got to buy into it. I mean, that's huge. And if you can't get your group to buy into it, then you can send all the messages you want, but they're not going to do it. So they have to know why they want to do it for them,
Yeah.
not why you want them to do it.
Mm-hmm. Yeah, that's a really important reason. Shalini, what did you find was from the article that was?
Sure. It was actually really very interesting. So here we are. So the document and the research says that our target audience is policymakers, opinion leaders, and voters. They are our primary target audience. But the strange catch is that the voters, opinion leaders, and policymakers also tend to come from the upper and healthier end of the distribution of income, education, and employment. Now, the other challenges are human attribute biases. Basically, it says psychological research has shown that humans tend to overemphasize individual factors, which basically means that I am responsible for my health. That is what humans tend to believe. The third challenge is prominent ideology of individual responsibility. Again, this also here shifts attention away from SDH and disparities in population health. The fourth challenge is public health research priorities. So public health research emphasizes on individual behaviors and medical care rather than SDH. And the last one is journalistic norms and practices. Again, they are concentrated on individual rather than broader social factors. And a great example this document actually gives, and I really like examples because they bring everything to light so clearly, is of the obesity epidemic that you all know about. But when you look at the research, when you look at all the research articles on obesity, you will see that individual factors, social factors, and structural factors are all responsible. But when you see the advertisements and the discussions on the news channels, you will see the focus is more on individual factors. So that is another huge challenge. And this is again a research which is included in this original research is by Christakis and Fowler.
Yes.
So I wanted to share those challenges, and it is an eye opener.
Yeah. Thank you, Shalini. That's a really helpful article. I think it'd be great if you could attach it and put it or maybe sent it. I guess I have it. I guess, can you
Awesome.
email something out to everyone in the class, or do I have to do that?
No. I will do that.
Yeah.
And
Why don't you put that out? That's right, because you can do it. Yeah.
yes, Dr. Marian, could I take just one more minute to just
Sure.
hear the methods, basically? And that's the crux of the matter now is there are 3 message strategies, which are the methods. One is the message framing, the second is the narrative or stories, and the third is the visual imagery. So in the message framing, basically define your social problem that you're trying to diagnose, make moral judgments, and suggest remedies to solve this problem. That is your message framing. The second part is the narratives and stories. Provide examples, and I truly believe that if examples are provided, we can connect to them, or we can connect to the issues that someone, Mr. John, is facing because, you know, he's of a specific age, or, you know, he falls under this category of income. So provide narratives and visual imagery. Now, the important thing about visual imagery is don't make that your focus. It should be very important, but don't make it as a distraction away from the SDH and population health disparities issue. Thank you, Dr. Marian.
Shalini, thank you. That's quite an in-depth update. And absolutely, it's an important topic. I think, you know, as healthcare leaders, really understanding why messages don't get out to the population. I mean, politics gets involved. People's readiness to change gets involved. The media that's used, the type of tools that are used to communicate the message get involved. So there's a lot there. So why don't we keep moving? And I'm not sure we'll get through the next 4, but we might if people are keep it brief. So Jennifer, you're up on your topic. So do you want to take it over?
Okay. So the article that I reviewed several actually based upon a population that I've worked with for the last 12 years in home health, and that's elderly populations, more specifically our rural elderly patients. And I found this really interesting article because obviously where you live is one of the social determinants of health, and the clinical aspects only make up about 20% to 25%. So the rest of it is based on the social determinants, the social things around you that determine your health status. And so one of the things that we deal with in the medical field is rehospitalization rates. And of course, the penalties for that have gone up, and now it's been extended from 30 days to 60 days for some of the disease processes. And so this particular article is based on 30-day readmission rates. And so what I found interesting, and I'm just going to go down because I'd love to hear as many people as possible. I'm going to go down here and I don't have them memorized, so I'm just going to read the challenges that they have. And of course, we know that our baby boomer population makes up quite a significant portion of our population, and that will continue to grow. Oh goodness, bear with me. Okay, so the findings that were found in this article is there's 3 reasons that determining whether an elderly patient that comes into the hospital, what their disadvantages are or what their social determinants of health are, is going to be, as clinicians, we don't have a standard on how we agree to measure that, okay, that disadvantage. And a lot of times, and I know I've been uncomfortable in these situations in home health, you learn to get very comfortable because you're in all sorts of different kind of homes, and you learn to be natural so the patients don't feel uncomfortable. But a lot of times clinicians are very hesitant to ask those hard questions about, you know, where do you live? What is it like? What's your home environment? What do you have access to? And, you know, when you start talking about finances and things like that, or things that you may feel are personal, you don't always want to intrude in that patient. And it keeps you from really being able to identify what a patient's going to need to try to help them from getting rehospitalized or whatever they need to have to help their health improve. And the third thing was, we don't always know about what to do when we find a disadvantage. And I've experienced that myself as a clinician. A lot of things I just learned on my own. I don't have a degree in social work. I don't know what community sources are available, but I learned real quick as a home health nurse, because it's really hard to leave a patient's home when you see that they have all of these needs. You can't just leave them like that. You've got to find some help. And so that's a real disadvantage. And one of the things that they talked about in this article was areas of disadvantage, the areas of disadvantage index. And this was developed by Singh. I don't think it's our Dr. Singh, because I already looked at that in 2003, that it was developed to determine by geographical areas, by zip codes, where their disadvantage lies as far as related to the rural aspect of where they live. And unfortunately, they don't have this data across the board for everyone. It's public, but we don't have access to it. And so to me, what would be great is if when a patient comes to the hospital and they've got one of these chronic disease processes like COPD, CHF, diabetes, whatever, one of those chronic diseases, then they would be identified up front, and discharge planning could happen right then for that patient. I was always amazed as a home health nurse how many rural patients, because I covered counties that they're towns you've never even heard of, where the roads are made of dirt. There is no oil top road. There is no paved, I was in the middle of nowhere. And we often wouldn't get those patients on home health service for CHF until after they went to their doctor. And then they were referred, and invariably they had already gone back to the hospital by that time that it had rolled around. So they already had a rehospitalization within that 30-day period, and the hospital didn't identify their needs as far as the social determinants of their health. So in a nutshell, that's kind of what I looked at. And I thought this area code thing, this geographical thing, the ADI index would be a great way to target that rural elderly population and really make some more improvements in that rate of rehospitalization. And that's all I have.
Yeah, no, that's excellent. Well, when you think about patients that are discharged from a hospital setting, especially elderly, one of the strongest factors to be readmission rates is not having food, oftentimes, based on if they're in a food desert. And so here you have patients who are not being readmitted, or who are being readmitted to a hospital because they can't get food. And so, that's crazy when you think about it, right? And it could be either income-based or it could be geography-based if they're out on a farm somewhere in a rural area.
Exactly.
Whatever the reason. But I think from a marketing perspective, and this kind of plays also with your comment about patients who are in the inpatient setting, they come in through the ER, they get admitted, they get worked up, they get treated, they get discharged, then they go to see their physician for the follow-up appointment, and then you get a referral for home care. When you think about it, what happened along that continuum from a marketing perspective, from a messaging perspective, where people didn't know about the care that they could get from community resources? They didn't realize they could get food from folks. Different organizations could provide Meals on Wheels. All of those are marketing. All those are marketing/messaging considerations. So interesting, very good article. Anybody else have any thoughts about that?
I will say this, and I think this is kind of interesting. Eventually, Humana, I'm not a big fan of Humana, just because it causes so many issues from a billing standpoint. But some of the things I do like about them, when a patient's hospitalized that has Humana, they send them home, they mail them a box of food, which is kind of cool. And that's something that obviously the cost of that's going to be much less than a rehospitalization. But yeah, there's so many things, and often it's not money. Sometimes these people have money, but they can't get anywhere to get the stuff.
Very
anyway.
complex. Well, I think those of us who are attached to HCSC, social determinants, food disparities, all of that is so on the radar, and that really brings into the whole discussion of what's the role from the financing perspective, from a healthcare delivery perspective, on addressing issues that increase healthcare costs that are not healthcare related issues. And so, you know, what's the role of the health plan? What's the role of Medicaid? What's the role of Medicare to address issues? You know, I remember a story of a kid who was, these are two kids that were twins. They were in and out of the emergency room for asthmatic exacerbations all the time. And what they did is they went upstream and they looked at the kid's home, and the kids lived in a home that had a leaky roof. And so there was mold in the roof of the house. And so does it make more sense to replace the roof of the house than to pay for the emergency room services for a health plan? Those are the kind of things that I think that we are going to, you know, be faced with in the future, trying to get our arms around. So well, thanks, Jennifer, for that. Appreciate you signing up and helping us with this experiment tonight. And so our next victim, Kennedy, you're up, man. So I'm going to leave you to go off of mute and tell us about your article.
All right. Thank you, Dr. Mayer. Can everybody hear me okay?
I think so.
Okay. The article that I read and was written by Dr. Nolak. She is a professor at the University of Chicago, and the article is she was trying to quantify neighborhood level of social determinants to healthcare across America and how we compare using those social determinants to other countries. So she looked at neighborhood and physical environment, how it affects health, population health. And the reason why she did the study, she wanted to have quantify these social determinants so that she can give it to key stakeholders, insurance companies, providers to see if they can improve that. And one thing that in comparing the social determinants of the neighborhood and physical environment, she discovered that in the U.S.
Kennedy, you're breaking up. I think we lost you, Kennedy. Can you guys hear me?
Yeah, I can hear you.
I think we lost you, buddy. Kennedy, we can't hear you. I don't know if you've lost connectivity or what. Well, I was really looking forward to hearing the punchline. Ah, here he comes back. He's reconnecting. Good. Hearing the punchline of that article. I'm always interested in what's happening in the rest of the world compared to the U.S. I think it's fascinating to compare and to look at factors really across the world from a healthcare outcomes perspective, cost perspective. I think there's a lot that we can all learn from each other on these important components. So. If Kennedy's not able to roll back, hey, Joe, you might just want to be ready to be teed up if Kennedy is unable to reconnect.
Okay, I'm back. I got dropped.
Good. You got kicked off, eh? You got kicked out.
Yeah, actually, I live in the country, so our network is very bad.
Crazy.
So the thing that she discovered was that even though we are using the social determinants here in the U.S., we are, as compared to other countries, other developed countries, we are behind. We don't use and apply the findings as much as other developed countries do, which was, and I think the reason she gave for that is because maybe the other countries, they use it more because the developed countries have, social healthcare systems like they have in England and in Canada. So she was speculating on that. So with the physical where you live, what it boiled down to is, her finding was that at the end of the day, it's pretty much driven by income. And if a population group is in a low income group, their housing choices are either going to be government subsidized, inner city, or living in the projects, and the health outcomes there are superseded by other factors like violence and crime. So somebody living in a very dangerous area, their mortality rate might actually be affected prematurely. And she gave an example of Chicago, that some places in Chicago, it doesn't matter if you're healthy or not. It's what depends on the extent of how your life is going to be is what violent crime do you encounter. So
Yes.
that was an eye-opener. I was like, so then she went on to look at another group of low-income people who have managed to move out of those dangerous housing areas, and they go to better neighborhoods where they pay rent, and the burden on them, some of the people, becomes most of their income goes to pay rent, and they don't have enough money left over to buy healthy food choices or even to think of purchasing healthcare. So food, nutritious food and healthcare is no longer a priority because they have moved out of the dangerous neighborhoods and the built environment, but now the burden is, most of the money is going to pay rent. Right. Then the third group in the low income that she looked at was those who live in crowded, they share, like they have roommates and they share the dwelling place, and they end up living in a crowded house and where diseases are easily passed, and it's just unhealthy. And then she looked at the affluent, people with money, and the housing and the physical environment does not really affect them because they are in good neighborhoods and they can afford nutritious food. And what disappointed her in her research was that even though comparing to other countries, if you take a middle-income person in let's say in the US, and if you take a middle-income person in Canada, the social determinants are kind of against the person who lives in the US, and the life expectancy or the outcome of the health it does not favor somebody here because our health, our population health, and our healthcare is mostly determined by income. So that was kind of an interesting factor, that everything kind of in the US comes back to how much do you make as compared to other first world countries where it might not be the best care that is given, but it's available regardless of how much somebody makes.
Yeah. I think there's another piece too with that, Kennedy. I think other countries in the world have built a much more robust community health-based model where the U.S. has focused so much on specialty care and on acute care and on the building of hospitals. And, the U.S. really leads oftentimes in the technology space. And so oftentimes that becomes the focus where, some people will say that, after World War II, when much of Europe was devastated by the war, that community health system, the health system of public health in the community began to really build up in that way, where the U.S. sort of had a different trajectory in how they built up their model around healthcare delivery. So that's a very fascinating article, Kennedy. It sounds really like an interesting read. Is there any one or two points you want to make before we close out and move on to Jill?
I think I'm done. We can move on.
Really good. That's really good. Thank you for bringing that to the group tonight. I really appreciate you taking time to look that up and read it and share with us about.
Sure, you're welcome.
Great. So good. Jill, how about you giving us your overview?
Sure. Okay. I'm going to do something a little bit different. My article had a lot of data to look at. So I'd like us to look at it together based on our other class. We learned how powerful it is to be able to look at different representations.
Great. You're going to take over the screen?
I'm going to try to. I'm not familiar with Zoom as much as WebCT, but sure.
Okay. All you do is that little share button down there. You just click on it. Great.
Okay, are you guys
I
seeing
love
it?
You got it. Good job for your first
Okay, perfect.
time. Great.
So basically, this article is a nice intro to what the social determinants of health are and basically how it applies to nursing practice. So I think it's really interesting considering the conversation that we've had thus far and from a managed care perspective in contrast to Jennifer's community health perspective. So we've got some information here. This is basically just about how the World Health Organization's Commission on Social Determinants of Health actually defines what it is. So you can see there, it's defined as conditions in which people are born, grow, live, work, and age, and the fundamental drivers of these conditions. So considering that information, if we scroll down and look at each of these graphs and consider about how that would impact our membership, it's really important to look at. All right, so this first figure here, we're looking at life expectancy in the U.S. at age 25 by education and gender. Okay, so what we can see here is typically the women live longer. We are aware of that. But when you think about the fact that chronic disease tends to impact our older patients or membership, it's interesting to think about what the difference is here when you see how many people don't even reach the life expectancy where they would be impacted by those chronic conditions. So it is very important. You can see here that the college graduate obviously has the least impact in comparison to those that are most impacted and have the youngest life expectancy based on less than high school. It's very interesting thus far. If we go on and look at one of Dr. Kennedy's favorite topics, strangely enough, is infant mortality, which I feel like we talk about frequently in his classes. You can see how it relates to the mother's education level specifically. So based on this data, again, college impact is showing so much impact over how long over infant mortality. Now, if we look here at children less than age 17, you got to think about how social determinants of health play into this. Now, if you've got a family with 2 working parents, typically what we used to refer to as a latchkey child situation, are they going to be able to just go get well visits? No, they're not. Like in terms of keeping up with that and keeping up with preventative care in the first place is very difficult. I know it's difficult to get away right now, especially during COVID with parents working and trying to work from home. Getting into the office and getting these visits even scheduled is difficult when you're not faced with these hardships from a social determinants of health standpoint. And again, this is going down towards the family incomes and how this is impacted in terms of chronic disease. Now, we've already talked about the food deserts and how that could be a problem with conditions such as congestive heart failures. And thinking about South Dallas specifically, for those of us in the HCSC population, I mean, there are just a real absence of grocery stores there. And also, honestly, medical care. There's not a lot available there. So it can really impact how members are able to even pursue chronic care and get things handled before it escalates to the point where they would need an emergency room visit. If all we've really got in South Dallas as a resource is, Methodist Charlton and the major Methodist hospital that's kind of near Bishop Arts, I mean, we're looking at a real problem here.
Yeah. A lot of great data there.
Yes. And then this breaks everything down by race as well. So you can see that's also important. very similar with what we've been discussing.
Mm-hmm. You know what it seems like I'm seeing across this entire, is really education is, well, how could education affect health? I guess I should just shut up, right?
There you go. Okay, yes. And to Jennifer's point, discharge planning does begin at the initial admission.
Mm-hmm.
But one important factor as to how marketing impacts my particular job is, I'm a nurse and I manage a team that handles clinical interventions. So we're trying to educate people as best we can about all the resources that are available to them, like Humana's Food Box. But how exactly can you educate people if they don't want to be educated, like you mentioned? You've got to be able to engage them. When you think about something, say COVID, for example, how are we going to work around COVID? A lot of people say the obvious answer is telehealth. We can't get out. We're sheltered in place. Let's get some telehealth going. Okay, great. How do you get telehealth set up? Will you use your smartphone? Are people with social determinants of health going to have a smartphone?
Yeah.
Are they going to have a computer to set that up? I mean, it's a real problem.
Mm-hmm.
So in terms of thinking about how the message is delivered is also very important. You could send a letter, but frequently people are moving in and out of apartments. We've talked a lot, particularly in Dallas, about rent adjustments being made for renters in light of people in the restaurant industry losing their job. There's going to be a lot of flux with people moving around. It's going to be hard to contact them via letter. And again, telephones, I mean, if you don't have a smartphone or you're working a job at odd hours, it's just difficult to know how to engage them. So a multi-messaging is going to be really important so that you're able to engage them in some kind of way.
Hey, Joe, was there one or 2 points that were the biggest takeaways you could share with the group? Because I want to make sure we have a few minutes left for Whitney if she wanted to give her.
Sure.
Great
Again,
article.
yes, I think that. Sure, yes, I'll link it. I think that education was really the highlight here, and basically just going over the importance. One of the main points that they made was that the effects of social health on outcomes could be responsible for as much as 10 to 15% of preventable mortality in the U.S. So it's just crazy. Very high number. So yes, I thought it was a great article and happy to share with you guys.
Yeah, would you please share that out with everyone? Because I'd like to take a look at this because I'm a big advocate for education. I think it's absolutely critical, and I'm thrilled that we were able to bring the master's program in Blue Cross and get you folks in it. Thanks, Joe, for bringing that up, and we'll look forward to reading the article. So why don't we take, Whitney, you're up next. So why don't you take a few minutes, maybe share with us what your article was.
Okay, just want to make sure, can everybody hear me fine?
Yeah, great.
Okay, awesome. So I'm going to try to keep it really short since I got like 7 minutes, but my article is kind of similar to, it was social determinants of health in adolescent pregnancies, and I chose this article specifically because I'm part of a Healthy Me, Healthy Baby coalition here in Tyler, and the overall goal is to try to the mortality rate, because it's not a fun fact, but a fact is that Smith County is number 2 in the state of Texas with the highest infant mortality rate. Yes. So
what number? Do you know what number 1 is, Whitney, by any chance?
No, I don't, but I can actually find that information.
Yeah, I'm curious. Thank you.
But so the article was talking about how there were studies that were done to show, why, or to show with the adolescents, who frequently had C-sections or had preterm babies, and that was in the African American teenagers versus the Caucasian teenagers. The adverse pregnancy outcomes really just relate back to socioeconomic status, rural residents, inadequate education, and basically not being mature biologically enough. So yeah, according to the article, around every year in the country, about 17 million teenagers are giving birth between the ages of 15 and 19, which is that's scary to be that young and giving birth, because you know at that age they're not really educated on what's going on, because it's like they're still kind of babies themselves.
Wow.
So my role in all of this is I work with grants, and we offer grant service or health services for people who don't have health insurance. We offer like complete wellness exams for men and women, and then our Texas Women, which is women's Medicaid, but we are paid to promote it. A lot of these girls, they don't understand that 6 weeks after they have their baby, they are dropped off of the pregnancy Medicaid. And then that's where I can come in and, get them signed up on the Healthy Texas Women family planning, where they, education about, birth control and for postpartum depression. And we also treat that as well under the grant. So it's a really good thing. And it just, like I said, it just like really spoke to me, because like I work in public health and community health, and I'm just passionate about educating. And then of course, being an African American woman, it's kind of see those statistics.
Yeah. And you're right there, right? I mean, Whitney, you're interacting with them real time, right? It's not like you're through a class or, in a very clinical environment. You're actually right there with them and really seeing what the deal is. So that's great work and a great article. So it's important. Yeah, I'd be interested to know what the number one county in Texas is for infant mortality. And I've heard statistics that say there's regions in the U.S. where the infant mortality rate is as high, if not higher, than some third world countries, which is not hard to believe. But data is data, right? So we have to figure that out. But all of these things, social determinants, how do we manage population health, all of the concepts that we're learning in marketing, all these things are really important. And I think that this whole concept that we heard from Jill around education, so critical that we push education in, and not only educating ourselves, but making sure that we're thinking about how do we educate the patients that we deal with, the customers that we deal with on things related to health and wellness. So great. Well, I want to thank our 5 presenters. If we could do some kind of little claps or snaps or whatever, we would do that, but we can't. Appreciate you guys stepping up to the plate. And I think we'll sign off unless there's any closing comments or anything that anybody needs to share before we wrap up the call. Okay, well, you guys have a great rest of the week. And Kim, hi to you. Little hand clap on there. Kim Abernathy, good to see that. And you guys are all like, what's the deal with the video? You guys are all doing emails and checking. You're probably writing your written assignments right now, which is fine with me. But I do like to see your faces every once in a while. So, all right, folks, have a great rest of the week, and we will catch up with you guys next time. Take care.
Thank you, Dr. Marian.
Bye-bye now.
Bye.
Joni's getting a workout. Joni, it's too hot to be working out, Joni. It's too hot, man.